Hi there, you're welcome to another exciting time on your health program, Heather Leaving, on your Dialing station with yours sincerely, Oloyi J. Oikoka. Yes, I'm standing in for Adesua Osawage on this wonderful day. All right, today on Healthy Living, we'll be looking at something that borders women. Yes, if you are a man out there and you feel, oh, it's all about women and I don't need to listen to this program, I don't need to get educated, but I need to let you know that as a man, you have a wife. Or if you don't have a wife, you have a sister. And in case you don't have a sister, you have someone that has someone that needs this information to be gotten to them today on Healthy Living. All right, with me today in the studio is a person of Dr. Stephen Ogbonwa, a consultant and a gynecologist. Good afternoon, sir.
Thank you very much.
All right, so today on Healthy Living, we'll be looking at bleeding in pregnancy. Yes, we know this happened to so many women in our country, Nigeria, and the world at large. So Dr. Stephen Ogbonwa will be here for us today to do justice to some of the questions we will be asking him, and also to let you know that, yes, our phone lines will be opened for you to ask our doctor today on the program Healthy Living. And don't forget that the topic is bleeding in pregnancy. But before we dive into bleeding in pregnancy, doctor, we would like to ask you, what is a healthy pregnancy? When you say pregnancy, you're it's healthy. What does it mean?
A healthy pregnancy is a pregnancy that is devoid of complications. When a mom is healthy and the baby is growing well and following all the parameters that we use to determine health in pregnancy, then we can describe it as a healthy pregnancy. We refer not only the mother being healthy, but the baby as well, without any complications in terms of congenital malformation, genetic problem, or the complications that are associated with pregnancy. Complication can be as wide as being diabetic in pregnancy or hypertensive in pregnancy, to bleed in early pregnancy. You know, complications like hemorrhage associated with ectopic pregnancy, for example, and as far as, you know, complications of miscarriages can be early or late, threatened or missed, as the case may be. So there are loads of complications that can occur in pregnancy.
Okay.
But sometimes women just go through without any complications.
So are we trying to say when a pregnancy has no complication, we're saying the pregnancy is healthy?
A healthy pregnancy is the one that ends in a healthy mother and a well baby.
Okay.
So you can describe as a very healthy pregnancy.
So when we say bleeding in pregnancy?
That's a complication of pregnancy.
Okay.
Bleeding in pregnancy can occur from the point of implantation of the human embryo to when the baby is delivered. That's the duration of pregnancy. Or we call our mothers call it 9 calendar months. All right. So bleeding can start from that point of implantation, which we refer to as nidation bleeding. Bleeding occurs in the lower genital tract. Any bleeding that occurs in the lower genital tract during pregnancy is called bleeding in pregnancy. And the duration is not limited to the earlier stages of pregnancy. It can occur in the middle of pregnancy, they call mid-trimester, or later on, there can be complications of bleeding, even the third trimester. And sometimes intrapartum, you can still have hemorrhage, that are complications of an ongoing pregnancy, then at that time in labor. So all these are complications of pregnancy. So we're going to take it one by one. But the easiest or the earliest is that nidation bleeding, that bleeding associated with implantation. When bleeding is associated with implantation, is the baby, that's the growing embryo, burrowing into the lining of the womb. The lining of the womb is a velvety tissue we call endometrial lining. It is soft. It's like a good carpet. A well-prepared endometrial lining is about 10 millimeters in depth. The baby sinks into it, as the embryo sinks into it and disappears, and you cannot see it under the surface. At that time, when it gets implanted, you can have drops of blood in some women, and in some women, they can even, refer to it as early, menstrual loss. It can be as much as what they see in menstrual loss. But generally, it's just a few drops in the earlier part of pregnancy. It's nothing to be worried about. Or women that bleed at this time, they carry their pregnancy to term. And it's just absolutely nothing to be bothered about. But quite a lot of women, they are bothered, so they go to see their general practitioner or their gynecologist. So they booked an ultrasound scan. This is not when you do pregnancy tests. Pregnancy tests you may have done and it's positive or it's negative. But at this time, even if you do a scan, it's unlikely you will see the growing, the growing embryo. At that time, it's very small. It's not a fetus yet. It's just a live embryo. So, but a gynecologist can measure the thickness on the endometrial lining and relate it to the day of the cycle and can confirm whether there is an ongoing pregnancy. But it's still indeterminate. You have to wait for a few weeks, at least 5 weeks, because before you can see something that is clear, with an ultrasound scan finding. Pregnancy test prior to this time is what most people use.
Okay, so at what stage would we say bleeding is too much? At what stage should the patient run to the doctor?
Well, just like I said, it should be drops. Any bleeding that exceeds what you observe during a normal menstrual period can be referred to as being excessive and abnormal. So the woman who is involved should seek help.
Okay.
Yes.
Okay. So what are the causes of bleeding in early pregnancy?
There are various causes. It depends on when it occurs. I've just mentioned one, bleeding associated with implantation. But beyond that, maybe 5 weeks, 6 weeks, 8 weeks, the pregnancy may implant in the wrong place. Instead of being within the tube, within the uterus, then it gets implanted somewhere else in an ectopic position, which can be in the tube, in the apulary region, or in the femoral end. Sometimes it's completely outside the uterus and the tubes, and it can occur in the pouch of Douglas, on the ovary. All of them will refer to as ectopic pregnancy. And sometimes the position is indeterminate. Then we call it pregnancy of unknown location. There is a pregnancy. There's a blood test to confirm that it's a pregnancy. There's no ultrasound scan find it to determine the exact location. But the blood test confirm the woman is pregnant because there's an elevation of the human chorionic gonadotrophin hormones. But you cannot locate the pregnancy either in the pelvis or elsewhere. Then it's indeterminate. So the general term is pregnancy of an unknown location.
Okay. Now we hear of some cases of women that they'll say, oh, the baby cannot stay. She has had a miscarriage. She cannot carry this child to term, or her womb is not strong enough to carry the embryo to term. From embryo it gets to fetus, right? Now it can carry this fetus to term. Now, what causes this?
Okay. Well, there are a lot of things that causes a miscarriage. There are various forms of miscarriage. Miscarriage can be quite early, and it can be late miscarriages. Some miscarriages, there may be evidence of threatened miscarriage, but it may not get to the full-term miscarriage. We call it threatened miscarriage. There are those miscarriages that occur without the individual knowing, without the doctor knowing, but suddenly, there's no evidence of pregnancy anymore. We call it a missed miscarriage. M-I-S-S-E-D, missed miscarriage. All right? So you talked about threatening miscarriage, a miscarriage, then a complete miscarriage, in which case the growing embryo the growing embryo, or later on the fetus within the sac with the associated placenta is passed, complete, you know, sometimes into the toilet, sometimes while a woman is, wherever she may be, she just passes, associated with the gush of blood, or associated with gush of blood and liquor, that watery substance, you know, where the baby births. So all this can occur. These are various forms of miscarriages that can occur. But there are situations where particular women are unable to carry pregnancy to term. So for example, we have blood disparity. If a woman, you know, if the husband, for example, is rhesus negative, the woman is positive, and the man, through the fetus, has passed some strange cells into the maternal circulation. In that first pregnancy, the baby may not grow well. There will be problem, you know, we call rhesus immunization. That baby may be carried to term, and there may not be a problem. There may be, but in subsequent pregnancies, there will be problem, and that can predispose to pregnancy loss, you know, quite earlier on as a result of rhesus immunization. Now, the red cells within the baby, they just hemolyze. You know, red cells are the life carrying. They carry the oxygen that gives life to the fetus. So once that ability to carry oxygen from the placenta to circulate around the body of the embryo or the fetus or the baby, as the case may be, then there is serious complication, and you can lose that baby. Sometimes women lose babies as a result of infection. There are types of infection. It might just be straightforward infection, like the urinary tract infection that can occur, associated with sickness and vomiting and loin pain, and this can be deadly. Temperature rises, and the woman starts having low abdominal cramps, and she goes into spontaneous expulsion of the growing embryo or fetus, as the case may be. So that's, you know, urinary tract infection. There are other infections like syphilis, parvovirus, which can, you know, do damage to the growing fetus. Sometimes it may remove their heart, or having a 4-chambered heart, they have a 2-chambered heart. Instead of having normal blood circulation is abnormal, then they retain fluid and become very edematous. And as a result of that, they cannot survive extrauterine life. So when you see them ultrasound scan, you counsel the mother, you know, rather than wait for her to carry the pregnancy to term, when we know that the baby is not going to survive, you counsel the woman about intervention and discontinuing the pregnancy. Depending on the religion, some women we go ahead with it and have it removed or terminated, as the case may be. But others, as a result of their belief, they allow nature to take its course. Pregnancy grows, and we monitor it until such a time. Sometimes the baby is born before term, and what you see we don't generally look like a proper fetus, because there are changes. Quite a lot of infections viral infection, you know, can predispose to this. Genetic malformation, congenital malformation can produce dysmorphic babies that cannot, you know, be sustained in extrauterine life. So all these are possibilities of why a woman will lose a baby. Then look at trauma. Ordinary trauma, you are angry with your wife, you push her, she falls. When she's pregnant, she can go into spontaneous labor. and she loses the amniotic fluid, followed by a little bleeding. She goes into spontaneous labor and expels the fetus. So trauma, sometimes it's not as a result of home violence, but it can result from road traffic accident, can result from a fall. Somebody's going in the back of his house, he sleeps and he falls, and that can predispose to serious problem in the woman losing her pregnancy. So all these predispose to pregnancy loss. That is why when you're pregnant, you take everything slowly.
Yeah.
We advise bed rest, as much as possible. Avoid lifting, don't overeat, don't take alcohol because it's nauseous. Don't smoke, because cigarette smoke is very nauseous to the growing baby. All these little things that are dangerous to the baby. You can absorb it because you are strong.
Yeah.
The baby is a tiny little baby, cannot withstand, the nicotine content of cigarette. So it can produce dysmorphic babies, small babies, when we say babies that are growth restricted in utero. So all these things can predispose to it. Okay. Then there are infestations like malaria. Malaria parasitization of the placenta can make a baby not to grow, and they can cause, abortion, but it's a miscarriage. Proper term is it can cause a miscarriage, in a particular pregnancy. It can make the baby not to grow well, what we call growth restricted baby, or small for gestational age. When the baby is supposed to be the size of a 30-weeker baby, is the size of a 22-weeker baby. So the growth is restricted, and the baby will be described as being small for the gestational age.
Okay, and now you talked about lifting of heavy things.
Yes.
Why do people or doctors advise pregnant women not to lift?
Yeah, you see, anytime you lift, you cough, you have a tumor in the abdomen, you increase the intra-abdominal pressure, that will push on the womb and make the content to escape. That's why we advise don't lift. You see, God is a wonderful architect. The womb is created, the womb is like a pot. It's a pot that is inverted. The mouth of the pot is facing down. All right? Okay, and there are ligaments keeping that pot in position. And God so made it that at the earlier part of the pregnancy, there is something that keeps the mouth of the pot closed. These are the effects of hormone. I don't want to go into details because people will not pick it. So there are some hormones that keeps that mouth closed. And they remain closed until the triggers of labor comes into play. That comes up from the higher centers. There are also hormones. They now relax the neck of the womb. They relax it with what we call Braxton Hicks contraction. They come like every hour, every 2 hours. Then when it's getting time to when the woman is going to go into proper labor, they come more often. They develop into uterine contractions. Then they will tell the midwife, "Oh, I'm tightening." Say how often? They will say 1 in 20. He says, "You can stay at home. Don't come yet." So, but later they say, "Oh, it's 1 in 10." He says, "It's okay. Don't come. Gather your things. Take your slippers. Remember baby oil and stuff." Then it goes like that. Then it will increase to 1 in 5. To ask your husband to bring you. And by the time it develops, the frequency is 1 in 3. The contraction coming 1 in 3, and in certain situations it can come, 1 in 2. And when there's tetanic uterine contraction, can come every minute. That is not good. It's not good for the baby. It's not good for the mother. Because it causes the source of oxygen supply, the source of life from the baby. So when we see that, we give another small injection to relax the womb. Okay? And once the womb is relaxed, the blood flow to the baby improves, and the heart rate we are monitoring, on the baby monitor, will change. Instead of going like this, as if something is going to, some abnormality is taking place, it now levels out. you know, it
The
becomes
normal
a good
heartbeat
way.
rate.
You know, there is contraction, there's
Yeah.
relaxation, there's contraction, there's relaxation. That's what baby likes, because during that time, baby gets adequate amount of oxygenation. So baby survives. That is the situation. So it's advisable mothers who are pregnant, especially in the later part of pregnancy, in fact, throughout the duration of pregnancy, to take it easy and not to lift.
Okay.
Yeah.
All right, in case you just joined us, this is Heather Living on your Darling station with Oloy J. Oikokai standing in for Adesu Ausawage, and doctor is Dr. Stephen Ogbonwa, a consultant and a gynecologist. Now, I know you have lots and lots of questions to ask our doctor. Don't worry, when it's time, we'll give you our numbers to call in on the show, and you'll be here to ask our doctor any question you want to ask him. All right, doctor, I want to ask you now, so there are some things that we find our family members say, hey, this thing is hereditary. It's from the mother's mother. Okay, the great-grandmother. So we want to ask, doctor, is this blood-related pregnancy now, bleeding in pregnancy, is it hereditary?
Oh, yes and no, because you can have some blood problems that can be hereditary. I just mentioned one earlier, as some women carrying the rhesus gene, you know, they are rhesus negative, you know, and because of that, they have problems in subsequent pregnancy after the initial pregnancy. All right. There are other conditions. If parents were diabetic, you know, then the likelihood of the daughter or the children to be diabetic is high. So if parents are diabetic, the diabetes might manifest in pregnancy because it's a state of stress. You know, the way women eat. Women exhibit funny behaviors in pregnancy. Dialysis, there's just speed. For those who don't understand why, that is hormonally based, you can say this woman speaks too much.
But not all women speak.
No, but a majority.
Okay.
Others, they engage with what we call pica. They eat anything.
Anywhere.
Some eat, some even sand and clay. All right?
Yeah.
So they eat. It's a craving that's associated with pregnancy. So it can pass from, say, I saw my mother doing it, then you can do it. Okay. But diabetes can be hereditary. Hypertensive problems can, you know, also be hereditary in the family. So these are possibilities. The commonest example we refer to is diabetes. It can pass from mother, you know, to daughter, and it manifests in pregnancy as gestational diabetes. Then you can have gestational hypertension. They can have, you know, pregnancy-induced hypertension. That pregnancy-induced hypertension disappears at the end of pregnancy. But such women already has a marker of developing hypertension in life. You see? So when we are taking history, we are asking the woman question, say, in your first pregnancy, did you develop high blood pressure? So if she did, then she's more likely to develop it again, so long as she's with the same husband. All right? But there are those who did not develop it in their first pregnancy, but they develop it in subsequent pregnancy with a new husband. So these are research findings, or these are just variation in human genetic makeup.
Okay.
Yeah.
So the signs of bleeding in pregnancies.
Yeah.
So how can a woman know
well,
the
any bleeding from the lower genital tract is bleeding. So long as the woman is pregnant, you know, when a pregnancy has been diagnosed, you know, either by positive pregnancy test or ultrasound scan. But nowadays we base the diagnosis of pregnancy on scan, actually seeing it. Okay, actually on scan report. Okay, so the signs is just blood loss. Painless, it can be painless blood loss.
Okay.
Okay? That's what you have in threatened miscarriage. All right? Then you can also have painless blood loss when you have a placenta previa. You see, placenta should be located away from the cervical arch, but sometimes it's located close. It can be marginal, it can be grade 2, grade 3, or grade 4, where it completely covers the road. So there is no way that baby can come out except by cesarean section. And prior to the time of cesarean section, you will lose both mom and baby. But with the advent of scans, you detect it. There are those that are in the lower segment. As the womb grows, because the baby is growing bigger, it seems to move away from the road. And maybe a scan at 24 weeks might show that there's a low-lying placenta. But subsequently, at 36 weeks, it's no longer there because the womb, seems to have increased in size. And the distance between the edge of the placenta and the cervical arch has increased. So we'll say it's no longer low-lying placenta. We will allow vaginal delivery. But all these are scan assessment and reassessment to make sure that there is no danger to the mother and it does not increase the morbidity and mortality rate in that unit. So what it is that people guide against what happened in their hospital. You want your hospital to have a reputation. You don't want to say, that is where that woman died. So you do everything to make sure it does not happen. You understand? Yeah. So you follow all the guidelines as laid down, whether the WHO standard or we use the Royal College of London standard. You follow it and make sure you do what is right. And usually, if you follow the policies that have been laid down, the outcome is usually very good outcome.
Okay.
Yeah.
Okay. So a woman that has experienced bleeding in her first pregnancy, and it could be that as a result of this, the fetus did not or could not stay. Now, what are the precautionary measures the woman should take for the next time she is pregnant? Immediately she notices, oh, I am pregnant. I have missed my menstrual flow.
As a doctor, if I tell you babies are gift from God, what will you say? They are really gift from God because 20% of the pregnancies will go, no matter what happens, as a natural selection, because they have abnormal genetic makeup. The commonest abnormal chromosome that is associated with these fetus that are expelled are chromosome 16. When you have chromosome 16 in a baby, it's very, very likely that that baby, will be deselected, that baby will be, miscarried at some point. So how do you determine babies that get that abnormal chromosome? You don't know. Hence I say it is a gift. So when everything works out well for you, you just thank your star and thank your God.
Okay, we want to ask now, if the bleeding stops during the early stage of pregnancy, can it lead to ectopic pregnancy?
No, ectopic pregnancy is a specific condition
where
the growing embryo is not within the womb, but it's outside the womb. I described it earlier. It can occur in the tube. The tube is long. It has many parts. The tube, the isthmus end, the ampullary end, the fimbrial end. The embryo can implant in any of those places. It can implant outside the womb and the tube, in the pelvis, the patch of Douglas. It can implant on the ovary. All right? Yeah. Okay. These are ectopic. Any time the pregnancy is not implanted in the womb, it becomes an ectopic pregnancy. And those pregnancies are destined for doom. And they are going to get to a particular position because the covering membrane is weak. It's not as strong as the musculature of the uterus. They will give way and the woman starts bleeding. This is a very serious medical emergency when a woman has an ectopic and is bleeding. But sometimes it's concealed, and that is more dangerous. When it is not concealed and everybody sees under undies and dress, bleeding that can flow through a woman's leg and pool on the floor, that's a very, very severe bleeding. And she should be taken straight to a gynecologist who will make the correct diagnosis and do an operation to stop the bleeding immediately.
Okay. All right. It's still Heather Living on your darling station in case you just joined us. I was talking about bleeding in pregnancy. Now, you see the reason why you need to call someone by your side. You need to call your sister, your mother, your friends to let them know that, yes, there's a doctor in the studio right now talking about bleeding in pregnancy. It can happen to anybody, anywhere, at any time. Let's go for a short break. We'll be right back on Heather Living.
It is wonderful to know that Jesus died for me. Wonderful, so wonderful to know.
It's really wonderful.
Yes, it is.
And it calls for celebration.
Exactly.
Come Sunday, the 12th of April 2020, Independent Television and Radio will be delighting the Christian community once again with the Easter Agbedu Unparalleled.
Ooh la la.
Everything is working for my sake. Let's go. Children of God. Now, from the grapevine, dance and win a goat.
Goats? Really? I will be there live.
Bag of rice and other fantastic prizes in various competitions.
Okay. You out there, be a part of the fun.
Music to be supplied by El Shaddai Gospel Band and DJ Ultimate.
Remember, it's a family party.
Date, Sunday 12th April 2020.
Time, 11 a.m. starts.
Venue, ITV Radio Corporate Office, Glass House, Airport Road, Benin City.
Gate fee, 500 naira per head.
This program is partly sponsored by Scottish Post Limited, number 62, Arosa Street, off First East Secular Road, Benin City.
And supported by Uyi Technical Limited, dealers in all kinds of quality generators, spare parts, grinding machine, and pepper mill, number 79. 81 and 83 Mission Road, Benin City.
God's Time Investment, AC House, 65B, Mission Road, opposite Cooks Road Junction, Benin City, for sales of AC compressors, evaporators, fans, and condensers.
Jonasco Technical Company Limited, JJ Owa Junction, off Upper Mission Extension, Ute Quarters, Benin City.
Edward Broad Educational Services Limited, for 2 to 4 years post-study visa to work and remain, Suite 35, Ede Shopping Plaza, Airport Road, and 133 Agbo Road by Agbo Park, Benin City.
Named Energy Limited, 51 Akenzwa Street, near Olivia Waters, Benin City, for sales of cooking gas and cylinders.
Mother Care Shop, Mama Oyoyo, for genuine baby things at affordable price. Head office, 130 Upper Forestry Road. Branch office, 28 New Lagos Road, Benin City. Silvercast American battery for 75 amps, 100 amps, and 150 amps of battery for your cars, trucks, and generators at number 104 Akwakwava, opposite Polaris Bank, Benin City.
Easter Agbedu Unparalleled. Jesus is the reason for the season.
Party after party. Party after party. After party.
Thank you very much for joining us on the program, Healthy Living.
Organs in the body.
Okay.
It is an injury in the...
You're healthy, then you're wealthy.
All right, thank you so much for joining us on the program Healthy Living with Oloije Oyekokai. And I have in our studio Dr. Stephen Ogbonwa, consultant and a gynecologist. All right, we have been talking about bleeding in pregnancy, and he has told you the different ways one can get these or contact these issues with bleeding in pregnancy. You need to take good care of yourself. You need not to lift heavy things. And also whenever you see slight or little drop of blood coming out of your, will I say the private area, right?
Yeah,
yes,
the lower genital tract.
Okay, the lower genital tract, you need to go see your doctor. So, doctor, I would like to ask you now, is there any organization that helps to enlighten women concerning these things?
Yes, there are various organizations that help women, and they are out there. They are live, you know, they are associated with trying to support women who have had, you know, miscarriages, so that subsequently they do not have miscarriages. They encourage them to try again. There's one they call SANS, that's stillbirth and neonatal death society. They also do the same thing. And in Benin here, we've developed, you know, the Gabeland Health Academy, where people can come and have a discussion on whatever health issue, especially in obstetrics and gynecology, so that we have the experts, either midwives or the consultant, obstetrician and gynecology, would discuss with them and give them information on all these areas. They can just ask questions and help them. Sometimes women want a second opinion. You see, doctor tells you, I'm going to do this, I'm going to do this, and you do not understand, or either you do not understand or you are not happy to go along with the planned method of management, then you can come to us. We give you second opinion. We analyze the issue and discuss with you what the best approach is in terms of management, and send you back to your doctor. In that case, you obtain good information that will make you come to the right decision, so that which is good for your baby and for yourself.
Okay. All right. So in case you want to get in contact with our doctor, you have some questions to ask our doctor today, the number for you to call is on our screen. Just dial the number and ask our doctor whatever question you want him to answer for you. Doctor, I would like to ask you, is there a particular food that a woman takes that can result to bleeding in pregnancy? Either food or fruits. Now, some persons say, oh, when you're pregnant, don't take this particular food, don't take this particular fruit. Are there some things like that?
No, generally, there are fruits that are poisonous that we advise anybody, whether pregnant or not pregnant, to, you know, but there are things that can make the womb to contract. Things like olive oil and things, they should avoid such things. Anything that can make the womb to contract, they should try and avoid it. There is something our people put in soup, you know, that thickens it, you know, a lot of potassium in it. They should avoid such food. But generally, our countryside is filled with all forms of vegetables that are quite edible and healthy for our mothers. There's no need to eat tin foods. We have so much fresh food around that they can eat, associated with bed rest. And the other thing to say is that down here, men do not support women when they are pregnant. When women say we are eating for two, so they eat too much, they get blown up, their ability to metabolize the food is not sufficient. So they develop gestational diabetes, which we control by dieting. All right, so you avoid them, just eat normally. There's nothing like eating for two, which is wrong. All right. On the other hand, women should also have rest period. So create time to rest. Let your husband do the household chores, as the case may be, so that you can rest. Because as you rest, the blood flow to the placenta improves, then the baby gets good oxygenation, good nutrients, and grow appropriately. So that will eliminate or exclude intrauterine growth retardation or growth restriction for the baby, as the case may be. So your baby grows well, and baby is born and is healthy. It's a healthy baby that can withstand, you know, the complications of early life. And it's a healthy baby that can withstand infection. But more so, mothers should breastfeed their babies after birth, so that they can transform a lot of antibodies from them, you know, into the baby that is protective for the baby before the baby develops that baby's immunity to protect itself. Yeah.
Okay. Now you heard some persons say pineapple, it's not good when a woman is pregnant. How true is it?
I don't know about that. Because pregnant women, they eat all sort of fruits, including pineapple. So
now some person will be like, oh, it has acidic content in it, don't eat it, it can result to miscarriage and all of that.
Well, women take pineapples in pregnancy,
okay,
and they carry their pregnancy to term.
To term. Okay, so for that assertion is wrong.
Anything that has not been scientifically proven should be taken with a pinch of salt.
Okay.
There are quite a lot of information out there. Do this, don't do this, which are not scientifically proven. So the thing is to disregard them.
Okay.
Yeah. Pregnant women should eat as many fruits, cabbage,
as they can.
yes, because they are helpful. They contain appropriate nutrients and vitamins for the baby. You know, most times we give women, when they are pregnant, we give them vitamin B. There are various forms of vitamin B. We call it vitamin B complex. We give vitamin C. But this vitamin C they can get from our vegetables, you know, and as the case may be. So the thing is for them to eat good food. All right.
Okay, so we should eat good food.
Yeah, yeah, fruits. Okay. Yes, quite a lot of fruits in our countryside. They should eat it. We should not allow our fruits to get spoiled. We should eat them and preserve and export. But we should avoid anything that is canned, you know, because the useful life has expired.
All right. Okay, we have a caller online. Hello. Hello, caller. All right, call us on our numbers on the screen, and you hear from our doctor whatever question you want him to answer for you. You need not to pay, it's free. So you just call and ask him whatever question that is bothering you as a woman and also as a man. Like I told you earlier, this topic is not just for women only, also for men out there that have some questions to ask our doctor. All right, doctor, so how do we manage bleeding in pregnancy?
Well, first and foremost...
Okay, sorry, hold on. Hello?
Hello, I'm calling from Benin.
Okay, what's your name and where are you calling us from?
I'm calling from Show.
Okay, what do you have for our doctor?
Yes, in fact, I want to commend the doctor because it's quite expository, the topic with respect to pregnancy. Now, I'm particular about what the doctor said concerning BP, high blood pressure. When a pregnant woman in the first pregnancy develop hypertension, that there is a likelihood that the woman will be hypertensive, you know, maybe later in the future in her life. So I want to say, is there any treatment to that to prevent such occurrence?
So, okay, you're asking our doctor if a woman is hypertensive, right?
Yes, yes.
If it can lead to bleeding in pregnancy. Is that what you're asking?
Yes, yes.
Okay. All right, doctor.
Well, high blood pressure per se cannot lead to bleeding in pregnancy, but it can be associated with it. Earlier on, when I was mentioning high blood pressure in pregnancy, I said pregnancy can induce elevated blood pressure, which we call pregnancy-induced hypertension. But hypertension per se cannot cause bleeding. But in a hypertensive woman, if a hypertensive woman bleeds, then the bleeding is more torrential compared to a woman who is having low blood pressure. You see, when you are pumping something with so much force, the amount of blood that is being lost per second the volume is higher compared to when the pressure is lower. But to say the high blood pressure in the woman causes her to bleed, it does not cause bleeding in pregnancy. It can be associated with bleeding in pregnancy, but it's not a cause. And there are other factors that can cause bleeding in pregnancy that we have mentioned, from miscarriages, ectopic pregnancy, placenta previa, placenta abruptio, to rupture of the uterus, bleeding from the lower genital tract at the level of the cervix. All these are bleeding. These are causes on their own, not hypertension. But hypertension can coexist with bleeding in pregnancy. But the blood loss in a hypertensive woman is more torrential compared to a non-hypertensive woman. Hence, when a PET patient, is in labor and she just delivered, she bleeds more per unit time compared to the woman who is normotensive.
Okay. All right, Doc. We want to know how we can manage bleeding in pregnancy.
Yeah, bleeding in pregnancy is bed rest. All right? All the various causes are managed.
All right. Hold on, doctor. Hello? All right. Okay. Go ahead.
All the various causes are managed based on what the problem is. Number one, if it's implantation bleeding, you don't do anything, you just bed rest. If it's bleeding from ectopic pregnancy, you have to...
Sorry, doctor, I would like to pause you there. You said if it's bleeding from implantation...
Implantation bleeding, you don't do anything.
So from the start of you being pregnant,
yes,
when you notice, oh, I'm pregnant, you just bed rest till night.
Yeah, it's bed rest. Because there's nothing you're going to stitch or to sew.
Okay.
You just, give a woman something that will relax the womb and let her rest.
Okay, so all through her pregnancy?
Yeah, no, it's for a short time.
Okay.
After the implantation, the bleeding stops. Okay. By the 12th day of that life of the growing embryo, the bleeding, implantation bleeding has stopped.
Okay.
But if it's ectopic, you have to go in and stop the bleeding point.
Right.
If it's
Hello? Hello? Good afternoon. What's your name and where are you calling us from? Hello? All right, please, can you reduce the volume on your TV set?
Can you hear me?
Okay, we need you to turn down the volume on your TV set. All right, please, when you're calling us, try as much as possible to stay far away from your TV set, okay? All right, so from the management of bleeding in pregnancy.
Yes. So I tell you again, bleeding in pregnancy is managed based on the cause. All right? If a woman is bleeding as a result of a ruptured ectopic, the ruptured ectopic should be treated in the hospital by an experienced gynecologist. If bleeding in pregnancy is as a result of threatened miscarriage, then you ask the woman for bed rest and support the pregnancy so that the woman can carry the pregnancy to term. If the bleeding in pregnancy is as a result of incomplete miscarriage, then your duty as a doctor is to do a medical management of the remains of the product of conception and take it out. So that's that. If the bleeding is as a result of abnormal placenta location, which we call placenta previa, then your duty is to discuss with the woman, organize the time of delivery, and do an operative delivery so that you can manage the bleeding. So the management of bleeding is based on the cause of the bleeding. If, for example, there's an abruptio where the placenta just separates suddenly and the woman is bleeding, this can lead to fatality, either in the baby or the mother. Then she will be managed aggressively, stop the bleeding, deliver the baby, and quickly suture the wound and replace blood loss.
All right.
Yeah.
Okay, thank you so much, Dr. Stephen Ogbonwa, for taking out time to lecture us like we are your students. All right, I hope next time we'll call on you, you'll be here for us on Healthy Living. Right, as doctor has rightly said, you as a husband out there, try as much as possible to help your wife in whatever way possible you can. It has been bleeding in pregnancy. I'll be seeing you again next week for another exciting time on Healthy Living. Till then, do have yourself a wonderful day and stay healthy. Bye for now.